Hello and welcome to the Nano2All webinar. This webinar was developed as part of the Nano2All project's training materials. In this session, we will address the case study on nanotechnology in nanomedicine. So, why do we present this case study? This module introduces ethical issues related to nanomedicine. We take the development of a new nanodrug for tuberculosis as a starting point. The roles of different stakeholders interested in this product are also discussed. We aim to highlight some dilemmas in the development and governance of nanomedicine and show that different perspectives do exist. Why is a new nanodrug for tuberculosis needed? In 2015, 10.4 million patients suffered from tuberculosis worldwide. This resulted in 1.8 million deaths, over 95% in low and middle income developing countries, according to the World Health Organization 2017. Therapies take over 6 months and cause severe side effects. Patients are quarantined to ensure their therapy loyalty. In South Africa, the Council for Scientific and Industrial Research, CSIR, was developing Rifanano, a new targeted nanodrug delivery system for tuberculosis drugs. This reduces drug intake from daily to once a week. The whole duration of the cure may possibly be limited to 2 months, originally down from 6, and causes a smaller number of side effects. Patients can probably stay home rather than in quarantine in a hospital. However, before the nanodrugs can be given to patients, by law, their safety and efficacy must be demonstrated. However, this takes many years. The sociologist Trust Saidi conducted a study on the different stakeholders' perception of the new drug and interviewed scientists, policymakers, patients, nurses, and home caregivers about their assessment of risks and benefits of Rifanano before the product was available. What did different stakeholder groups think about Rifanano? The drug delivery group, which developed Rifanano, thought it is a life-saving drug that may improve patient compliance with the therapy. They were concerned about the unknown risks of the drug and assigned the responsibility for managing these risks to experts on risk assessment. Their time frame was long-term sustainability of the product. This meant that the drug developers and Institute for Occupational Health aimed to avoid introducing an insufficiently tested product to market. The National Institute of Occupational Health considered it a promising drug to be used with precaution. It is more effective compared to conventional medicine, but they were worried about the risks and uncertainties of nanoparticles. They assigned the responsibility to producers, who should abide by the precautionary principle. The precautionary principle means roughly that measures should be taken to manage risks even if these risks are still uncertain. Their time frame was also the long-term sustainability of the product. Tuberculosis patients saw Rifanano as a long overdue user-friendly drug, which could be used in a low dosage for a short period of medication. They were concerned about the known risks of conventional tuberculosis drugs and were willing to take responsibility upon themselves for taking the drug and bearing the unknown risks. Their time frame was urgency. Nurses caring for tuberculosis patients saw Rifanano as a better option, with an easy-to-follow prescription. They were also concerned about the known risks of conventional tuberculosis drugs and advocated for disclosure of the drug and offering informed consent to the patients. They were in favor of releasing Rifanano to tuberculosis patients, but also clearly informing these patients about the potential risks, offering them the opportunity of informed consent. Their time frame was also urgency. Home-based caregivers, including family members, saw Rifanano as a burden remover, reducing their own work overload. They paid less attention to unknown risks of nanoparticles and considered themselves responsible for making decisions on behalf of the patients. Their time frame was also urgency. How can we understand the context of this case? Traditionally, patients, nurses, home caregivers, and other citizens are not involved in preclinical drug development but do suffer side effects on existing drugs. Scientists, risk assessors, and authorities abide by pre-existing laws and focus on the unknown risks of the new drug, not taking into account the existing risks of already available drugs for tuberculosis. Information on Rifanano was only available to the scientists and safety assessors in the National Institute of Occupational Health, not for the other groups. Trust Saidi acted as a bridge by bringing in the information about the new drugs to patients, nurses, and home caregivers. Different stakeholders can make their own contributions to responsible nanomedicine. The starting point for citizens is to be curious. Only after learning about the new nanodrug could patients, nurses, and caregivers form an opinion about it. However, it is important not to embrace the new opportunity without reflecting on dilemmas. How can the risks and benefits of the nanodrug and existing therapy be balanced? Which underlying values are at stake? Note the different assignments of responsibility. Target the right level. Market acceptance of drugs is well regulated. Any change calls for wider public debate and political decision-making. The natural scientists in the drug delivery group already adhere by research ethics principles. They address value-sensitive design through to reduce side effects for the patient. It could be improved if the patients, nurses, and family would have been engaged before starting the research. The social scientists could engage in science for policy by communicating their findings to policymakers. Natural and social scientists could engage in public dialogue exploring if the current regulations are adequate for nanodrugs. Policymakers could reflect on the appropriateness of current regulations in balancing the need for short-term solutions and long-term uncertain risk, while the industry, media, and civil society organizations could consider how to contribute to the public dialogue. To conclude, the complexity of the issues surrounding the development of new nanomedicine for tuberculosis merits scrutiny of the interests of different stakeholders. The issues are a mix of technological, ethical, economic, and political aspects. A universal law, such as the one regulating market access of pharmaceuticals, may be too rigid in cases like tuberculosis, where the existing drugs are also far from ideal. Now, there is no legal room to let patients decide themselves after informed consent if they wish to accept the unknown risks of the new drug. Thus, flexible framework regulations offering room for social experiments may be preferred to formal universal laws. Thank you very much for your attention, and we hope this webinar has been useful to you.